My name is Roxanne Karani. I'm an acting assistant professor at the University of Washington in the Department of Medicine, and I'm also an epidemiologist with Public Health Seattle and King County in the HIV STD section of Public Health. Solomon, would you like to introduce yourself?
My name is Solomon Berhe. I have been living in Seattle since 1992. Diagnosed for HIV since 97. So I've been doing a community reach out most of the 2000s. I think I went out in public and disclosed on 2001. So I'm stressing the importance of early testing. Had I known what I know now, I would get tested. By the time when I get tested, it was at the late stage, almost AIDS by definition. I still think there is a lot of misunderstanding, the difference between HIV and AIDS. So if people know what I knew then, I think they go get tested. So that's what we are trying to really stress and push, starting from World AIDS Day throughout of next year, 2015. In many ways, there is a lack of information about HIV/AIDS here in the diaspora, in African community. So because of like the medication, it's not the one we saw in early 90s. You know, people, they don't get skinny. It's easy to really forget. There is a lot of reluctance. And also, what about once I know about HIV? So there is no really support once you know you're HIV. You know, no support group. You will be on your own. So that kind of really made it difficult. And also, if you can really help us a little bit more understanding about HIV and the law. You know, I mean, it's just very complicated. As an African, we just don't have any information. Once you really get diagnosed, you are not really given that information as to how you live from that on. So, okay, you're HIV, you give you medication. So I think we really have to really go back and take a look and learn from the past. And moving forward, is the health department, if they really come out and really talk to us more, by working together through the media, you know, we can really bring a lot of things out in open and discuss. In general, in our community, talking about HIV is very difficult. It's much easier to talk about cancer than HIV. You know, it just goes that religion and culture. Then the more we talk about it, the easier it gets. So Saya has been doing a lot of work around HIV/AIDS for years, and thank you for really bringing us all together on this World AIDS Day. Then I'll stop here.
Hi, my name is Scott Bertani, and I'm the Director of Prevention, Education, and Community Relations for Lifelong, which was previously Lifelong Alliance. I've been in the field in Washington State for going on about a decade as Director of Prevention Services for Evergreen Wellness Advocates, and we've recently combined forces.
Thank you. So my name is Mohammed Ali, and I'm African community health advocate in this area, and I've been doing that for so long, since 2006. But I coordinate a program called Hepatitis B Coalition of Washington, which is a hepatitis B, another issue that Africans and other immigrants and refugees are facing. So today I'm here because Asaya invited me, and I'm really very proud and happy to be here.
My name is Ali Adam. I'm a health equity liaison at Children's Hospital Department of Center for Diversity and Health Equity. I'm also a second-year student in Global Health MPH, and I'm from a member of this community from Somalia, and try as much as I can for the last 10 years to promote health in my community. And what Solomon was telling me is a very what you hear everywhere, you know, like, and that's where we have to overcome, you know, like how when you consider 20 million Americans don't speak at home language other than English, almost 8.5 8.5% of Americans are limited English proficiency. I mean, the language barrier is huge, and if you add that, you know, like culture, I don't know if it's culture barrier, but it's a culture differences. You know, like how we perceive stigma. You know, like and it's really sad, you know, like when the world HIV and AIDS in general are declining. The only community that having, you know, like that number is raising is a minority communities, and somewhere the ball is dropped, and so we have to investigate and ask ourselves, you know, like how this can happen, and hopefully we can have that discussion today. Thank you.
Hi, I am Adisu. I am a real estate agent actually by profession. Nothing related to the health. But yeah, I see it's very interesting. The other day I talked to Asai about the prevalence of HIV in Ethiopian community, especially the number is so huge compared to any others. So I thought it's very important maybe to come together and talk about it, and maybe there is something we're missing here. So yeah, it's very good that we come together to talk about it. Yeah.
Hi, my name is Brahanu. I have been to Seattle since 1985. I'm the pastor of Bethel Ethiopian Church, an evangelical church in the north side of the city. As I have invited me to get involved and hear and see what's going on HIV/AIDS area. Thank you for inviting me, and I hope we'll discuss more when we come to the point.
My name is Fasil Lasras. I'm Ethiopian Orthodox Tewahedo Church priest. I'm here because Asai invited me to attend this program. I'm happy to be here because the faith-based organizations are responsible to teach their people. So I maybe have something here. Thank you.
Hello, my name is Asfaha Lemlem. As I earlier mentioned, I am a board member of MMRTI. I work for Yesler Community Center as a learning center director. So we've had a lot of partnership to do technical work for use and raise issues, especially East African issues, and use media and technology to get the issues solved. And I'm happy to be part of this discussion. Thank you.
Asai, thank you for organizing this. This is step one, and I'm very encouraged and very humbled by this today event. My name is Girma Ayala. I'm originally from Ethiopia. I'm a chiropractor and have multiple clinics here in Seattle. And as a matter of fact, we're putting one community clinic in SeaTac, and to help this specific issue and other issues that's affecting our community. I've been in practice for about 14 years now. And I was about 2 years practicing. There was a young Ethiopian young lady. I remember that was in 2000, and she came in my office in downtown. Then after I discussed her symptom and see where she is, she was just beautiful young Ethiopian girl at that time. And I refer her to a medical doctor in Beacon Hill area, and he did tests, and she was HIV positive, and that was my first shocking and experience. I'm sorry. I tell you, this disease affects our community and our country so much, and it is just incredible to see this young man here, Solomon, who's been fighting alone, and he is our energy in a sense of this disease, and be on front, and to see a culture that's very tight, and this kind of disease, or any other disease for that matter, cancer and this critical disease, is so in each person's mind, but we really don't know where to start to discuss or to mitigate or to affect. So for him to come out and fight singly and individually is just sticking, and you are a great person, I tell you, and we have to do that, and we have to do more to our community around these areas, and see how we start this dialogue, and we can beat HIV. We can beat anything if we unified, but also respects that individual thinking, fear that they have, the stigma you mentioned, and the consequence of stigma. So, and also the result of what happened if that person is ready to have that thing, that life, sexual or married. So what I did was that young lady, just to come back and address your question in a very inclusive way, was we helped her. She get all medication, and she's now in Texas. She has 3 kids, and the person she married knows about her. She has HIV. She's now, I think, 34 years old, and she has beautiful kids. And still, I am her guidance in a sense. You know, we can beat this together. And so she survived, and she has 3 beautiful kids, and one of the kids now is, I think, 10th grade. And so this can be, we can do it together. We can help each other, and we are great people. We have a sense of love, unconditional love of each other, but we really don't know where to start this dialogue. And the source that we have here in the United States, we have not really addressed it, how to get that resources that goes in different areas. But at the end of the day, that you talk about the website resource that you don't have, we have to. So I'm going here in the forth, but I'm very excited. Thank you for that. And when I pass it.
So hello everyone, my name is Dr. Paul Jackson. I received my PhD in computer engineering in 1998 and I moved here to Seattle and started working. I've been working with ASAI for at least the last decade now, it seems, and I've done a lot of interviews here. We have the green screen, and so one of the interviews I've done is with Sophia Tashome, and I met her through working at the Department of Global Health at the University of Washington, and she got her master's when she was doing research on the Western medical practices and how Ethiopians adopted the Western medical practices in relationship to STD and AIDS. And so that conversation is out there in the cloud. It's out there. You can look at it. And I did it here. And so that's one of the things. But a lot of topics were talked about. I mean, talked about Africans, African Americans, immigrants, the whole culture, language. There's lots of things. And one of the discussions, I'll go back here, with Sophia and we talked about, is there was a book that Dr. Boyd Graves had written. Dr. Boyd Graves was in the military, and he came down with AIDS, and then he started doing research and found paperwork that the U.S. government, from their cancer research, developed AIDS. That's the claim. And so, and there's patents out there for both the cure and the cause of AIDS. And that information is not really out there. A lot of people don't know about it. And I don't want to be a conspiracy theorist, but as far as with the AIDS and the website, you said that you're a single person. And so the whole ICE challenge, that was really done by one person, a mother of a brother who found out that he had the disease. And so the family really kind of came together and figured out an idea, and it was really the mom that came out with the idea of the ice bucket challenge. And so I challenge you that don't think of yourself as a single person. You can't do it. You can, because it will take a little bit of help, but if you have the passion and the idea, there are people in this room that will help you make the website. I'm personally one that can work with you on that. You have Facebook. I worked with ASAI to create a website when he did his our AfriTech workshop a couple of years ago, and so that website's still out there. And so there's what resources that you have and capabilities where you can be a point person to be a game changer. You know, so don't think of yourself as you can't do it. You can do it. Just positive energy. There's more, but I can't think of it. There's a lot of topics. I'll pass the mic. All right, and goes.
Thank you.
As far as the East African, in particular the Somali, is concerned, when I saw this thing, I'm sorry, my name is Mohammed Shah Hassan. I didn't introduce. I realized that I didn't introduce. My name is Mohammed Shah Hassan. I'm a community member, Somali community member. as well as I work for the city of Seattle. And my job is community relations. I work with the mayor in terms of immigrant and refugee issues. So anything to do with it, so I am the community relation person. Prior than that, I was very active in the community. So that being said, I came several times here for different types of interviews with Asai, close work with him. Matter of fact, we even created an African media center, but it didn't go nowhere. So we did try, but it didn't go nowhere. That being said, when I saw this one by email, thank for Sai, I was quite shocked, in fact. I mean, this is not the number that I was expecting. I mean, I was so surprised. And I said, wait a minute, this is alarming. And more often, how often do we talk about these cases? Basically none. Yes, it's a taboo, but taboo can be overcome as well. Cancer back home in Somalia is another taboo. People will never feel that this person has a cancer. Now, more than ever, people are quite adamant, say, well, he died for cancer, she died for cancer, he had a cancer, he survived for cancer. Why? Because this disease become more in the media or in other places, or the doctors are simply prescribing now more often, and people are dying it. Well, the taboo is no longer there. Now, how can we educate our community? We have a lot of graduates, we have a lot of college kids who are open-minded. And I think if we tap those folks to become the spokesperson or the advocacy for that, I think we may have a little chance of going through that. When we educate them, the young kids or college graduates from the community, I think people will have a better understanding for that. That's one part of it. The second part of it is the religious leaders, the imams, which have a high number of people coming in their mosques or, in the other hand, churches or synagogues. I think they can play a big role. Media is not the main extreme media, what I'm talking about, ethnic media. Ethnic media can as well play a role. But to us is, I mean, Solomon, I have to give him a credit for his coming out. I wish we could have many more people come out like that, and I think we have a better understanding. Solomon, for a long time, he was by the sole person for East Africans, and I believe 23% Somalis alone is a high number. 23%. It's not a small number a month. Look at the 34% Ethiopians, 13% of Kenyans. I mean, this is a very high number, 27 of Zambian, Eritrean, Zimbabwe. Number is alarming. So the question is, how can we ask those people to come out of the shadows? On the other hand, to come out of the closet. Remember, once upon a time, gays were something that the people cannot really even mention about it. Now people are coming left and right and proud to be that, because after long struggle, this can be another case like that, that people, we encourage people to come out. Disease, I mean, it's not a curse. Disease can happen to anybody. Nobody's immune of, conceiving this, having this disease. I mean, it happened. I mean, we are lucky that we are not getting it. Well, there's nothing guaranteed that you won't. People have to understand that concept. It's not the one person who's getting it and that's it in the end of the game. And I think education is something that can really change the whole entire. It's upon us as respected leaders, professionals, doctors, all about, to start charity begins at home from our own families, giving them understanding. I remember I was the first African to support the gay mayor. That was a lot in my community. And I mean, I have taken a lot of beats to that, saying that besides, I run a mosque. People call me Sheikh. I mean, respect me to that. I am very well known in the city. I'm very well known in the county. First time I supported bring him into the mosque, saying that this is the community. It was alarming to my community. However, I mean, that's the decision that I took it. But people overcome that. People overcome the myth that they have, and reality is quite different. So what I'm implying to that aspect is, yes, there might be a couple of people who will come out. The surprising will be the first days, and if many more comes out, people will get used to it, and so many people will come out. And I hope we can get a young people who have this kind of disease so they can be example, because the other young people are quite be sympathetic for the other ones. And that goes to the parent, that goes to the community, that goes to the community at large. So I'm not praying that people have it, but those who already have it, I hope that they will come out. And I thank Asai for bringing this issue over and over and over. He is the mouthpiece of the community. I really appreciate to be a part of this. And this is, and I have to thank Solomon for the great job that you're doing. The other folks who are doing the medical field, yes, we have a long way to go, but we'll say never, never. We'll continue as much as we can. Thank you very much.
I'd like to remark on something that Solomon brought up, and that is the fact that in the African community, people generally are diagnosed much later than their U.S. counterparts, particularly because in King County, our HIV epidemic here is predominantly an epidemic among men who have sex with men. And there have been a lot of prevention messages directed at that community over the years about having protected sex and being HIV tested and taking care of yourself. And the community responded to that. And now we don't see people going as late in their illness and then being diagnosed as was the case previously. But we're still seeing that in the African community. So in King County, we know that among men who have sex with men, about 25% of people who are diagnosed with HIV go on to be diagnosed with AIDS within 1 year. But when we look at that among heterosexuals, which is predominantly among African-born people in King County, that number is more up around 50%, or sometimes in some years 60%. So what we often see when people are diagnosed with HIV is that they're diagnosed in the hospital because they're very, very ill. And that's not good for them, and it's not good for the community, because the longer people go before they're diagnosed, the less able they are to protect their partners, to protect their unborn children, if they're women who are of childbearing age. It's very important to get people tested. And when we're missing the opportunity to have people tested earlier, it's sort of multiplying the problem within the community.
Yes, so then we go back again that early testing, just like she said. Then on faith-based church, I think they can play a very important role. Culture. So that's where we have to really try to do more work, by working with you. As we know that the treatment has improved, a great deal. When I started my medication, I was lucky actually to be diagnosed on 1997. Those powerful life-changing medication really started on 1996. It has improved. When I started, I think I used to take like close to 20 pills. Like 4 times a day, you say to your Arab, it was that difficult. But now, really no reason. Although people like to know their status, then again, once I know there is a medication now, it's not a big deal, stuff like that, then I think the faith-based can really play important role. So it's really make it easy for other people, really, especially for a newly diagnosed, support. I've never gotten any support from my church, really, and it's like a one-day show, then after that forget it, so then there is a responsibility among all of us to really participate. This is our community at risk, our sister, our mother, our kids. So I hope that next year will be, from now on, will be different than before.
On HIV/AIDS. Absolutely. Our organization does twofold, and I want to comment on some of the things that you both brought up. Is one, we do medical case management, and we also do highly targeted outreach and prevention for specific communities. And absolutely, within King County, probably 75% of all diagnoses are within the MSM community, and there has been often a dearth of information and communication to some of the lower prioritized communities. And as a result of that, we do see that there's a lot more late-term diagnoses than there ought to be, especially when we have opportunities for testing and treatment. And many individuals don't necessarily know the resources or where to go to be able to get access to things like the early intervention programs, which helps assist individuals through those medications. So it's one of the most important things that we can probably do is disseminate communication and information about what those resources are and where to get tested and how to get tested.
Thanks. So for me, what I would have really started with is, it was really touching when you say that if I knew what I know now, I would have tested earlier or the beginning. So which means that after those long years and experience, now you have the knowledge that you need, and you are the most expertise in this area, Solomon, really frankly. But education, whether you disagree what you are hearing from the media or from the scientists, from the epidemiologists, from all this, everybody. So I think our communities, what they need is starting from scratch, telling them that this is empowering them and giving them that knowledge. Then the person, when they know that this is a really serious issue with them or with the community, because if I pick my community, Somalis, I have not done these studies, but when you look at the numbers from in Somalia or outside Somalia, that knowledge is very low. That question still exists, is whether this is not for us. This disease is for other people or for those kind of things. So we need that education piece, which really educates the person, the community, and then influences behaviors, and also now they could be part of the solution. So what I have learned is the people in the diaspora are less educated about HIV than those in Africa or in Somalia. Because we moved to US 20 years back, or 15 or 10 years back, when that stigma or when those issues were really, and we were frozen in that era of the HIV knowledge. Because of the PEPFAR and other funding back home, behaviors have been modified, religious or community-based, and programs bombarded with funding has been done. But our community here, we are in a situation that we live in a country that we could do, or we have the accessibility with the treatment and testing and programs are there, but we are not taking advantage because of why. So those are things really we have to look into and then start solving those kind of questions, which education comes, because not only HIV, even hepatitis or any other disease, even diabetes, that's the time really these communities, they have other issues uncountable. They are dealing with other unheard of challenges in their life. So we need them to be part of the solution of their own self, of their own family, that will be real. The education comes first, and then that's the time really we need testing, and then the community will take advantage of the resources that's available to them. My first is education. Thanks.
I'm currently doing research about perceptions and barriers to clinical research for East African communities, and the finding is it's stunning how the community, when you think about what is the barrier to clinical research, what you have is barrier of language. You have a great deal of mistrust in the communities when it comes to clinical research in general. You have our communities who felt, like we associate them ourselves when we arrive as a new immigrant. The closest group that we can identify ourselves is African American, and we often carry that experience that African American has in this country and what they're going through. And when you add that to language barrier, culture indifference, religion, that there are so many barriers to overcome. And what I notice, like our community most often are ready to take and tackle issues, but there's no resource to do that. And it's really difficult in order to get, if you have individuals from community who knows their community, who have the knowledge and expertise to advocate the issue, they don't often get that opportunities. You have to rely other organization or third-party organization to advocate your communities, and we have to remove that barrier. We have to see, what is important to us it has to come from us. And this topic, HIV and AIDS, is not immune. Is not the only, issues our community faces. Like you can talk about dietary, you can talk about justice, you can discuss so many different issues where we lack a lot. And we are behind. So the most important question is, like, to begin, we know the issue. In America in general, like 20% of the population who's in HIV affected, they don't even know. So like the testing, we are not only people who are not testing. Like when you have 20% of the individuals who live with HIV, they don't even know they are HIV. It seems that we share with other community, but what is us even makes more despair is like the lack of resource, the lack of language, the lack of understanding, education. Education comes when you know things, when you're willing to seek and get information. But if you don't even have desire, or if you don't have, if you can't even cross that bridge, like to get that information itself is a issue. So I don't honestly know like who to blame. It is not blaming game here, but I often feel, I look my community and I see despair, and I see a community that who really forgotten, to be honest with you, and how we go from there. Like how you can. When you have brave individual like Solomon, who's willing to put, like what we call ourselves, when he's willing to sacrifice himself, that's exactly what he did. Like he can be quiet and have his medication, go with his daily life and regimen, and he doesn't have to deal whatever. It's not easy. I know from East African community, someone, like who's HIV and who's saying, I'm here, like it has to take a lot of heart. And I can't say enough. You are one of the heroes. Like if we want to say someone is the hero, that should be you. But again, we should have people like you who's leading this, and like saying, this is what is best for us. As you say, like early diagnosis is the best thing can ever happen to you. Like if. But how to do that is another like discussion. I
First of all, I want to thank Asai to inviting us here to have a panel discussion and create awareness. Thank you for your effort and bringing us together. Secondly, before I go to the detail, I would like to apologize and ask forgiveness of to Solomon. You have said that you have exposed yourself, but no support comes from the community, and either from religious leaders or church leaders. We are behalf of all the community leaders and the church leaders. I want to say sorry. We really apologize. You are one of the person out of 600, 500, or over that number came out, expose yourself, say about your lifestyle and yourself, and create awareness among the Ethiopians. But even it's not a shelter issue or a meal issue, it is even a moral support. Someone, how are you doing? How is life? How are you getting? Even just a word was not given to you. We are very sorry. Accept my apology. Secondly, I'm also, as a pastor of the church, I also have a media called Wangel. We work together sometimes with Asai. It is 1 hour and 1 hour and a half program in a week time. It is mainly almost 100% spiritual. Recently, I have been thinking of and doing something else in addition with the spiritual, at least 10 or 15% of the time to create awareness about health, eating habits, HIV, AIDS, orientation, whatever you call it, any area. So I'm thinking of that. That's one of the reasons I came to get educated. We need to be educated, whether we are a community leader, we are a church leader, whosoever we are, we need to be educated. as church leaders, we know that majority of our people in the church area, their lifestyle is not as the same as the people who are not going to the church or who are not church active people. So it's not that much spoken that the lifestyle of the Christian lifestyle is a little bit different than the others. So it's not that much. It doesn't mean that Christians also didn't have affected by this. They may. It can happen. You can't control anybody. You can't control everyone in the church who is attending the church or who is serving the church. It can happen, but to create awareness if it happens, as many of you said that the testing or be an example to be tested and know who you are, what status you are, that is good. I don't want to repeat it again. It's also good for both of us, the community leaders, whether church leaders, to be an advocate. The pastor or the priest may not be an advocate, but we can initiate a person from the congregation to be an advocate for such a kind of a meeting or create awareness among our community for educational purpose and as well as addressing the issue. Long time ago, as many of you know that even right now, even at this moment, people may think that the person who is affected by HIV AIDS, if he is shaken by a hand or if you are very close to him, if you hug him, the mentality of most of African people or other people think that it is sometime it can happen in the mind of people that that sickness will be transferred, but it is not. I have been hugging people who have been affected by HIV/AIDS. I have been shaking hands. I have been eating together. It will never happen, and it's not happening that way. So that is the education area which people need to be educated, and we have to treat those people as like other person. Our attitude has to be changed. If our leaders' attitude is changed, the congregation and the community attitude will be changed. There's nothing wrong. It can happen to anybody. So create awareness and have a knowledge base about that issue. And it is also our responsibility to speak it out from the pulpit, from in the stand where we preach the gospel. We need to input some of the issue which can be helpful for others.